some silly topics.
I was going to say, I like that answer more than the certified health nut, although I like the certified health nut answer.
So there's been claims out there that sun exposure to your rectum.
Rectum, yeah.
Will do what?
Boost testosterone somehow.
He's like, go
I
on.
have no
go
idea.
on.
Yeah. So you it's like getting sun, but you put your butt up to the sun?
Put your,
I got it somewhere in one time.
I know, man.
So tell the people the technology behind it, fill in the holes a little bit so people can understand it better.
Let's get outside naked and shine your ass to the sun. There's lots of melanin in your anus, and that melanin is connected to your nervous system. So get the light into the melanin in your eyes, your hair, your skin, your anus, your nutsack, your perineum, and then you're golden, literally.
You turn the electricity on, because let's face it, the sun is the source of all life on the planet. And for all you clickbait journalists out there, and Josh Brolin, you knucklehead, the fact of the matter is we're not talking about burning your skin. We're talking about 30 seconds to
5 minutes?
maximum. That's if you feel the energy at all. Otherwise, just take 30 seconds and you tell us what you feel instead of the fear mongering.
This guy's cool.
Yeah.
So he had posted a video a while ago where he said some of the best ways are to sun the rectum, to smack your testicles.
That's not going to
Do
unless it's by accident.
I'm just like looking at Evan like, how you gonna deliver
How
this?
are you going to do this one, bro?
Yeah.
And to, I think he said ice baths too. So he was.
I believe the order was after he got out of ice bath.
Yes. Rectum
Yeah.
slap.
So
Yeah.
And then warmed up with the rectum.
Yeah.
And then warmed up with the
Yeah.
rectum in the sun. Yeah.
Jeez.
But
Makes
deer
total
antler.
sense.
I've heard that before.
Yeah, have you?
Yeah. Yeah.
So I didn't know about that.
So, and then, Brett, I'm glad you're posting this because, guys, you have to remember how norms are arrived at, okay? You're taking 30,000 random people, you're taking a measurement, you're finding the mean, taking 2 standard deviations, and there's your normal range,
Yeah.
okay? So, to illustrate the point, 74% of the United States population is overweight or obese, so it's normal. Right?
Sure.
Because it's a trait that's shared by greater than 50% of the population.
Sure.
It's normal, but it ain't good. I can
Yeah.
go through the list if you need me to go through the list.
That's a great point, though.
So, so when you see for a male 208 to 496, that might be normal, but I think 350 to 850 is your more ideal range. Same thing with women, 15 to, they've got 16 to 32 there. I like 15 to 60.
He's talking about testosterone levels.
Yeah. So,
Do you think that prostate cancer is linked to low testosterone?
no.
No.
And I also don't think that high testosterone causes prostate cancer, but I do think it will make it grow faster.
Okay.
I think prostate cancer is rotten rust. I think it's fungus and toxins. Right? Fungus is antibiotic, steroid, living or flying at altitude or eating sugar, birth control pills. Toxins is living in a country that burns 19,000 gallons of gasoline in 1 second, which is our country. Complicated by what doctors are doing to people, which is gadolinium for MRI scans and thallium for CAT scans. Complicated by 85% of the people in this room, including me, have a mutation to a gene that codes for a detox enzyme called MTHFR.
Oh, I do too, yeah.
Those people are fighting that toxin battle with one arm tied behind their back. So fungus creates an acid pH, toxins create an acid pH, cancer grows good in an acid pH. There's your prostate cancer cause.
I went to the emergency room and they did like a scan.
CT.
Yeah. And I remember you saying something like that effect on your health or for somebody like that is like smoking like, what did you say? Like, what did you say?
Yeah,
You
so
remember
guys,
that?
this is I swear that this is a true story. It took me 4 kidney stones to figure out I was creating my own problem by juicing spinach. Spinach is high in something called oxalate.
I've heard about this, man.
So I'm really, I'm taking care of Evan and Mark.
Yeah.
I'm taking care of my patients, but I'm not taking care of myself. So I'm asleep basically for a period of time. So I'm at the urologist's office, not as a doctor, but as a patient, trying to figure out my kidney stones. Dr. G, take a number, have a seat in the waiting room, and we'll call you when it's your turn to go back to see the doctor. So I go over there, in the waiting room, it has a couch there that has a circular table with magazines on it, guys. And I swear to God, what I'm about to tell you is true. Never had happened before in my life, nor has it happened since.
Mm-hmm.
But on that particular day, when I reached down toward that table to pick up a magazine, I'm not particular. I just want to pick something up and kill time before they call me for my appointment. The entire magazine that this article is in, as I reach down like this, it lifts off the table about a quarter, I swear to God, about a quarter of an inch and jumps right into my hand. Time Magazine, June 25th, 2012. Not in 4 years of med school, not in 3 years of residency, but as a guest in a doctor's office, do I learn that day that the radiation from a single CAT scan is equivalent to smoking a pack of cigarettes a day for 19 years.
That's what you said.
That was in okay.
that's a
That was in
crazy
the
story,
magazine
by
you're
the way.
saying?
Time Magazine,
Yes.
June 25th, 2012. They cite the Journal of the American Medical Association, Lancet, and the American College of Radiology. Because when I hand this reprint to my patients
Yeah.
and they go to their doctor,
Yeah.
I don't want the doctor saying, no, that's that crazy Dr. Ganino quack
Right,
guy who's
right,
way out
right.
there on that. No,
were like,
no,
Yeah.
I'm sorry. JAMA, Lancet, and the American College of Radiology has more stripes on their sleeve than you do.
Yeah.
Oh man, that is wild.
Yeah. When you
Yeah.
It
Same
is
thing as
wild.
going through the airport scanner 70,000
Oh
times.
man, I heard that.
Yep.
Oh wow, really?
Well, every time I try not to, they're always like, "Get in there."
I
I'm
know.
like- I'm always like, "I want to do this one." And they're like, "Dude, come on." And I'm
My
like,
wife always opts out. It causes a line behind us.
I was
It's a
gonna say, do they always
disaster
give you
having to get
pushback?
somebody. They always
Yeah.
like roll their eyes, but
Dude, when you
She's
told
smart.
me that, Dr. G, I was almost like,
I'm going to show you guys a
I
text.
should have
that
just
came
smoked all those cigarettes, dude. Because, the nostalgia of smoking cigarettes, like as
So
an
much
80s and
more
90s
fun.
kid,
Yeah,
was like,
supposes a person to. There you
was
go.
so
smoked them.
cool. The radiation
smoked
stuff
those
freaks me
stoves.
out, man.
Now
That's
that-
really scary.
That, you guys asked about the spike protein. We got nothing for that. I mean, we got stuff to help
Yeah.
with toxins, and we can't reverse the spike protein.
Yeah.
But we do have an IV that partially offsets the damage from CT.
Oh, really?
It's called superoxide dismutase. It's a free radical scavenger. So it's not perfect,
Yeah.
but it's better than nothing.
Yeah.
Now back to scans. I want to show you guys this miracle. Now this particular miracle, this guy's name is Albert, and he was on Know the Cause.
Okay.
He and I went on Know the Cause. He had his Yahweh shirt on
Oh,
with him.
cool.
I
Yeah.
had my Faith Like Noah T-shirt on.
Yeah,
We were,
love it,
we were-
love
we
it.
were we were kingdom dudes on that day.
That's cool.
This came across today at 8:04 a.m. Just got another stable scan. October 14th was 36 months. So this guy was diagnosed 36 months ago with something called a oligodendroglioma. So this is a malignant brain primary tumor in his head. Okay. So stop making cancer, right?
Yeah.
No smoke, no drink, no gluten, no sugar, and claim the spiritual high ground, which is forgiveness 24/7, 365. All that's in the category of stop making cancer.
that is tough. That's awesome.
Number 2 is cut out the cancer, which is surgery. Had a great surgeon, female, Dr. Patel. She's amazing. And number 3, strengthen your immune system. That's all the stuff we do.
Sure.
Right? Chemo's not on the list. Radiation is not on the list. So he's got his doctors down at UT Southwestern that are following him. Every time he goes in there for Dr. Ganino approved MRI of the brain without contrast. So guys, there's 2 safe tests in medicine, MRI without contrast and ultrasound, okay? So he goes in for MRI without contrast every 3 months or whatever to get one of these scans. And every time he's in there, Albert, you know that the standard of care is MRI with contrast. He says, it might be the standard of care, but my doctor's not going to let me do it. Why isn't he going to let you do it? Because it's toxic. It's gadolinium, has a 30-year half-life,
Yeah.
right? Without me in your life to chelate that out of there,
Sure.
30 years from now, half it'll be out. 60 years from now, 3/4 of it'll be out.
just
And 90 years from
insane,
now,
man.
7/8 of it'll be
insane.
out of your body. So you can't do gadolinium. Okay, Albert, but you also understand that part of the standard of care treatment for what you have is chemotherapy. Now understand the median survival for these people is 15 months. And he says, I don't want the chemo. Why not? Because it's poison.
Yeah.
So at what point, so we're 36 months out.
Yeah.
At what point do they wake up and say, wait a second, the standard of care is chemo and gadolinium, and these guys are kicking the bucket at 15 months. This outlier over here named Albert, he's not doing the standard care, and he's kicking ass 36 months later.
They'll never come up with it.
Maybe we should sit down and have a conversation with him.
You would think, right?
It's the most logical thing, right? It's the most logical thing, and it will never happen.
No.
It won't ever happen as long as there is the money that is being made. And I mean, that link that you had sent me from Mercola, I think it's so interesting. There's more and more science every day about cholesterol.
Yeah.
Well, about cholesterol not really being a leading factor in heart disease almost at all. I mean, there's a little bit, I guess, in there, but still statins are on the rise and they're pushing them as hard as they can. And it just goes back to show you, man, the greed that is there is just insane. And that's not to say at all that statins haven't helped people. I'm sure they have. But with new science coming out like it is, you can't make the claim that that's the only thing going on.
Brett, do me a favor. So when Dr. Sinatra was training me in my master's program at the University of Connecticut in 1983 and 84, 4,100 heart attacks in the United States per day, with 1,500 of those people dying. Okay, that's 1984. I wonder if we could get, how many heart attacks in the United States per day, and then how many of those people die.
Yeah.
I'm guessing the numbers are going to be pretty similar. Let's see what Brett gives us.
All right, let's see. There were about 1,905 deaths from heart disease each day in the U.S., including heart attacks.
Oh, now there are 2,552 deaths from cardiovascular disease.
Okay, so in 84, it was 1,500 a day with how many? With 4,100 heart attacks and 1,500 dead. Now it's 1,900 dead, did I see? And then how many heart attacks? 1,900
deaths, 605 new heart attacks and 200 reoccurring heart attacks each year.
Oh, okay. Well, that's easy. I can do it. 605,000 divided by 365 days in a year. Everybody following it?
Yep.
Okay, so 1 second, guys. 605,000 divided by 365.
Well, no, you'd have to do 805,000, right? Because that's new heart attacks. Plus the recurring is 805,000.
Oh, I'm sorry. Yeah, okay. So
that's going to change the number.
That's why he's the producer.
805,000 divided by 365 equals, okay, so 2,205 heart attacks per day.
And that's each day, okay.
And 1,900 are dying, I think. So that's interesting. That's shifted a little bit in that there's less of them versus 4,100. There's only 2,200 now per day.
What was that in the 80s, you said?
Yeah, in the 80s.
Okay.
But there were 1,500 deaths out of the 4,100, and now there's 1,900, so it's less,
right.
but more people are dying from it.
That's interesting.
So here's my question.
Interesting.
Here's my question. If we have the brain power to invent this device that I am holding in my hand, are you telling me that we cannot impact heart attack?
Yeah,
that's
of course.
Total horse.
Yeah, yes, it is. But you could take that to any disease right now, right?
Yeah, of course.
Yes, there is new stuff coming up and it's weird and it's untested, but man, heart disease, cancer, diabetes, all these things that you have been working with for years and years and years.
Yeah.
Yes, of course we can make a change in that,
So, heart attack, according to Dr. Ganino, according to me, high cholesterol is an invented disease. If you can invent a disease, you can invent $1 trillion medication to treat it.
Yep.
Keep everybody focused, distracted, and scared in this camp, and keep them distracted from the real cause of heart attack and stroke, which is inflammation. How sticky are your arteries? How likely is it for cholesterol to stick to your arteries?
To repair whatever the actual problem is.
Yeah, and the marker for this is called homocysteine. So everybody watching, you need to have your doctor check your homocysteine level. The ideal, not the average, not the normal. We're not looking for average and normal. You want your homocysteine at 7 or less. If your homocysteine is 7 or less, you have non-sticky arteries. And that's good because the statin drugs have many, many potential side effects. Cognitive impairment, liver dysfunction, acute renal failure, cataracts, muscle pain, joint pain, muscle breakdown, diabetes. All that's in the Journal of the American Medical Association. I believe, guys, that's March 11th, 2012, I think.
Ooh. Is homocysteine the H in MTHFR?
What's that?
Is homocysteine the H in MTHFR?
homocysteine and MTHFR are absolutely totally related to each other. The same supplements that support the function of MTHFR, which helps us detox, which is less cancer and Alzheimer's, are the same supplements that decrease homocysteine.
Huh.
You know, that's interesting.
So as it stands now, we're getting $1 trillion over here for the statins, and we're still getting 256,000 over here for the quadruple bypass graft. When the truth is sitting in between the two, it's called inflammation. Yeah. So get your homocysteine down, and then this. Now I had a guy in today. His name's Roger. He's got high homocysteine, and he's got a 368 total cholesterol and a 244 LDL. This is not a good thing. And this guy's already had quadruple bypass. So I said, Roger, I think what we need right now is we need you on a statin, providing you tolerate it. Sure. It doesn't give you muscle pain or joint pain. It gives you muscle pain or joint pain. That crap's going in the trash pronto. We're going to switch drugs. But providing you tolerate it, we're going to have you on a statin to get your cholesterol down. That's one side of your Velcro. At the same time that we got you on this natural stuff to decrease your homocysteine. Once your homocysteine gets good, we can chuck the statin drug in the trash because cholesterol doesn't stick to a slick artery. It only sticks to a sticky artery.
So in a sense, a statin is doing a job that they think is going to fix the problem, but it doesn't encompass the full scope.
I don't think
that
seems
like
a
Band-Aid.
I don't think. I mean, Brett, you know, we're talking about these minds. No, these guys know the real deal. They 100% they understand that it's about this.
Yeah.
But this is treated with $3 $15 a month supplements.
Are you able to see?
And a statin drug is whatever it is. And they're coming up with more and more stuff that's just ridiculous.
Right.
I was going to go back to just other things that you're doing there at the clinic. I remember going and because there's also different uses. I had a virus and I went and seen you and we did an IV therapy and kicked it within like a couple of days. Yeah. You know, like you get the flu. Yeah. You can kick it in a couple of days.
What'd you do? IV therapy?
Yeah. I went to his office and did IV therapy.
Yeah.
You know, if somebody else gets somebody gets the flu and you normally hang on to it for, 7+ days, you feel like crap, dude. Yeah. But like the best thing I could have done was like go and jumped on IV therapy. Yeah. And I did it. Yeah. I did it 2 days back to back and 48 hours. It's just like,
yeah. Wasn't that what Joe Rogan did whenever he got the thing that we can't talk about? Yeah, he did IV therapy and then he did that other thing that we can't talk about.
Yeah. So Mark's talking about we call it IV hydrogen peroxide just to differentiate it from another IV we do called IV vitamins, which is pretty self-explanatory. But yeah, the peroxide works on candida, works on viruses. It's tremendous at decreasing plaque in arteries. I can give you those cases if you guys, and again, they're in the book as well. Yeah. And then IV vitamin C, is another. I did, yeah.
But just awesome. Like I've told everybody, like if they're local, like, dude, you gotta go see Dr. G to get the IV therapy.
I wish I was local and I could do that, man.
I like that, Brett, right there, guys. So, annual cost, not bad. Right? Yeah. $2,100. I mean, it's a lot, but it's not horrible. Yeah. But the next line is key. Statin therapy is often a lifelong deal. That's where they get you.
That's really tough. Yep.
So it's half the United. I know my calculator wouldn't hold it, but if half, we'll say we have 335 million Americans. We'll say half of them are adults. So that's whatever that is. And then say half of those have high cholesterol, then you've got that number times 2,100.
So roughly 70 million times.
There you go. Times however many years the person lives. So
real quick, back up real quick. Homeocysteine, was that what we were talking about? Is that right? Homocysteine.
Inflammation in your arteries.
Are you able to check that on a standard blood test?
Standard blood test.
Okay.
But you got to ask for it.
Got to ask for it. Okay.
Doctor's not going to do it unless you ask for it.
Have you ever treated somebody that had like COPD or anything like that?
Oh yeah, sure.
Is that anything?
Oxygen, hyperbaric.
Any reversible or any?
Well, here's one thing, guys, that most people don't know. If you are a smoker and you quit smoking, your chance of heart attack decreases 50% after 3 days.
3
wow,
days?
Really?
Get you some of that.
Wow,
so
that's cool. That's great.
Yeah, it's number one thing that best thing anybody can do for their health, hands down, no doubt about it, is quit smoking. Number one thing. Yeah.
You tend to really like oxygen treatment, yeah?
Yep. Oxygen, CPAP, Hyperbaric, yeah.
What's a good way for somebody to like administer that at home? I mean, are there options with that at all?
Well, you know, I should know this and I don't, honestly. I don't know if you can just like a random person can just go like buy oxygen.
That's what I was thinking.
Without,
like,
without a doctor's prescription. I would guess that it's not. Can we ask that question?
Yeah,
Sure.
we can. I know that you can buy oxygen. So
Well, you can get those little like
canisters of
spray
oxygen,
things, right?
and there is a difference. I
Yeah.
mean, when
Yeah.
I was in Colorado over the summer,
Yeah.
and
Yeah.
you hit the oxygen,
Yeah.
you feel it.
You
Yeah.
definitely feel it. Yeah.
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 But is that just as good? Do you think? Just not just. I mean,
nasal oxygen. Most of our patients with that are over 70 years old, if they've got sleep apnea, I mean, it's just the equipment's kind of cumbersome for a lot of these people. So
Yeah.
we'll just put them on oxygen at night, 2 or
Okay.
3 liters at night, and put it on when you go to bed.
Okay.
Take it off when you wake up.
Okay, cool.
Younger people, we typically like to try them on CPAP because it's just a very efficient way to deliver.
Yeah,
to,
sure. Sure, that
down
makes
here,
sense.
which is where all the exchange goes on, is your distal alveoli into your capillaries. So you want to try to get it down there as far as you can.
Let's see. What does that say? Was there more oxygen during dinosaurs? The atmosphere of the Earth was 80 million years. The atmosphere of the Earth 80 million years ago was discovered to have 50% more oxygen than modern
Wow,
air.
did not
And
know
I
that.
even heard. I don't know if
did
it
not
was
know that.
Callie Means or Casey. Is that his name?
Yeah,
I think they might have been talking about our air being contaminated with microplastics. Like you can't take a breath of air without ingesting plastics. Awesome. How about that?
Yeah. The
I mean-
chemtrails.
Oh
Yeah,
yeah.
yeah.
Oh yeah.
Don't
Man,
get me
we could go
started
down
on that, man.
Ooh.
Don't get Brittany started on that.
I know Katie's the same way.